Patellar tendinitis, if you want to get rid of it, this is what you're going to need to do. I'm Dr. John from Mobilize, and here is how we approach patellar tendinitis for our patients and patient athletes. First, I figured I'd get a little bit into what is patellar tendinitis. Sometimes you'll hear it called jumper's knee. What it's not is it's not runner's knee. So it's important that you understand what it is and what it isn't, which is why you need to hang in there in this video if you want to see more of the anatomy and physiology that Dr. Chloe Costigan, our resident expert in all things anatomy and physiology and PT, is going to go over with you. Patellar tendinitis is an overaccumulation of force in the muscle of the quadriceps muscle. No, you don't need to be jumping in order to experience it, but commonly jumpers will feel it because they are creating huge contractile forces in their quadriceps muscle, which is putting force in the patellar tendon. The more you get down and explode up, the more you are using that quadriceps muscle, the more you're using the patellar tendon. Patellar tendinitis speaks to you do a thing that you haven't done often. You never really jump much, now you just got into jumping, or you took a long break from jumping or training your explosiveness at your knee, and now you're feeling some inflammation. But if you are a triple jumper or a basketball player, and you've been for a long time and you're experiencing that pain at your knee, it's not patellar tendinitis. It's most likely patellar tendinopathy or patellar tendinosis, which is very similar, but it's more of now you've been doing it for so long that there's thickness in that tendon around the knee. What that means is you're going to have to do a little bit more of different parts of scraping and the manual work. And yeah, while strengthening is still going to be important, if you have patellar tendinosis, you're going to need to dig at that thing a little bit more to break up that thickness, to make some changes to the structure of the tendon, so that way you can get past this issue.
All right, guys, let's talk about patellar tendinitis, and we'll talk about the anatomy. So just to orient you guys, we have the patella here. Here's the front of the leg. So here are 3 of the 4 quad muscles. We have vastus medialis, we have rectus femoris, we have vastus lateralis, and then vastus intermedius. So those 4 muscles make up the quad. You have this quad tendon, which comes down into the patella and then comes across, and then here you are with the patellar tendon. This area is continuous. What happens with patellar tendinitis, so you start to get this pain underneath the knee, particularly when that knee is bent, or if you're going downstairs, running, things like that. And that's because of this tension that is occurring in the patellar tendon, and as well as inflammation. Now, where does that come from? That comes in part from some of the pulling of the quad muscles. So think of if all of these muscles get short, then it's like it pulls everything up. So then that's why you're starting to get a point of tension then, because it's pulling on the tendon. That creates inflammation of the tendon because it's pulling where it attaches to the bone. If we take a closer look at this patella, so here's your patella, here's that quad tendon, and then here is that patellar tendon. You see here too, there's a lot of places where you can get some inflammation because there's a lot of connective tissue in this area. So sometimes when people complain of patellar tendinitis, you know, they say feel a little bit of pain in this like inner portion of the knee, or just on the outer portion, just on either side of the patella. And that's in part because of some of what's called the retinaculum, which is connective tissue that's continuous with the tendon. So if this is inflamed, remember that whole area is being pulled, so you're going to get some of these points of tension as well. Another contributing factor to patellar tendinitis is actually this gastroc soleus. So here's the gastroc muscle. This is what we typically think of when we think of the calf, as well as the soleus, which is deep to that. Now, if you see here, we've taken away some of this musculature, so you can see here is that back part of the knee. What ends up happening is that can actually kind of contribute to how that patellar tendon is able to function, how the quad's able to function. So don't forget, if you do have issues of that patellar tendon, don't forget about the calf.
I want to talk to you a little bit about our favorite ways of treating patellar tendinitis. One of my favorite ways to get rid of patellar tendinitis or patellar tendinosis is going to be using the scraping tools. So a muscle scraper, I grew up in this world of PT calling it Graston, but now there's a lot of different types of muscle scrapers. We like using the Sidekick. It's what we use in most of our videos because it has a good weight to it. It's made of solid steel. The weight and the steel is important because you don't have to put as much effort in and you can feel more with it. So if I just let these guys rest at the side for a moment, when you are scraping, and you can watch some of our videos about how to scrape, but to get into it a little bit, you're going to want to sometimes have tension in the muscle and sometimes not. So first, I'm going to show you this while I'm seated. Here's my kneecap, right? Here is my patellar tendon, sometimes called patellar ligament. Above it is my quadriceps tendon. So they're both connected to the same muscle, but once the quadriceps passes over the patella, this little bit here becomes the patellar tendon itself, which is why patellar tendinitis is often felt more right here. But you could have suprapatellar tendinitis and it be felt up this high, which is why we're going to scrape over all of it. So as always, when you're scraping, you are looking for bumpy, rough, kind of gravelly feelings around the area, and you're going to canvas all around to make sure you don't miss anything. I'm not going to go over the kneecap itself, so you don't want to go over bone, but you can go all around the kneecap and frame it out, and definitely go up through the quad muscle itself. You're going to want to go through the entire quad muscle, because if all you did was cover just around the tendon, you'd be missing on a large part of what causes the tension and the buildup in the tendon itself. If you imagine that this entire muscle here connects and anchors right down here. So if you think about this spandex I have on, the more tension I get up here, the more I'm going to feel the pull down here. Think about like a boat that's anchored to a dock. If the boat starts pulling away from the dock, but it's anchored to the dock, you start pulling at the dock itself. That patellar tendinitis is taking that patellar tendon and it's pulling from the bump here, your tibial tuberosity, which is on the bump of your tibia, which is where this quad attaches to. And if you keep pulling and pulling because of tension through the quad on the tip here, you're going to run into issues with inflammation down here. The bone itself is going to start to react because it's trying to fight back. So you're going to, for that reason, get all around the quadriceps muscle itself, and not just on the patellar tendon or patellar ligament. So remember, you're going to first scan around, find areas that are bumpy and gravelly, and then you're going to want to spend about a minute, 2 minutes maybe at most on those areas that are more gravelly. So if it feels nice and smooth and you don't feel anything, you can move on to another spot. You'll know when you get there because it might feel uncomfortable, a little more painful, whereas before you felt nothing on just a spot next to it. But you'll also often feel some tactile feedback in a steel instrument like the Sidekick here. For those of you looking for a little extra improvement, you can actually extend and bend, or you can even come up and squat down while you're muscle scraping through and around those bumpy gravelly parts. The 2.0 version of muscle scraping is doing it with movement. So add some movement to it when you're confident that you know where you're targeting. Do that about every other day, once a day. If you do it too much, you're not necessarily going to hurt yourself, but you could cause a lot of inflammation, and then you might just get stuck in that inflammation and not feel like you're getting out of it. The other thing you can do if you don't have a muscle scraping tool, even though I recommend everyone does, is you can approach that same idea using a foam roller. So if you wanted to, you'd still be covering that same area. So if I came down here, I can still roll through the quad muscle. I can't go on the kneecap itself, but I can roll all over that quad, scanning and searching first for areas that are bumpy and painful. Like right about here is where I feel like a big lump or a bump. And then the 2.0 version of foam rolling would be bending and extending just like so, about 10 to 15 reps, just like you did with the muscle scraping. This you could do though every single day, and you should. The more you do foam rolling, the quicker you'll get to the point where the foam roller no longer hurts. So in terms of what you need to do is you're going to need to do some sort of breaking up of the tension of the area, and that's where a muscle scraper, a foam roller comes in handy. But you can also use muscle floss, which is one of our go-tos, because with muscle floss, not only are you covering a lot of area at once where you're flossing over, but you also can do a whole lot of movement with it, which is hard to do with a foam roller and even harder to do with a muscle scraper. So if I'm using muscle floss, I'm going to get just below my kneecap because I want to cover that patellar tendon, and I'm going to come around. And then once I get my anchor, let me create a little bit more length here. I'm going to start to come up over top of the knee. And now this one's a little bit shorter, but you're gonna work this tack and floss band all the way up as high as you can up the quad. I'm gonna tuck that underneath, trying to make sure it's nice and tight so I'm catching some of my spandex by accident. Once I have that tucked underneath and I'm covering below my kneecap, and even I'd come up a little higher in my quad, then I could do those same movements, right? Because I'm tacking down the muscle, down the tendon, and now I'm flossing by bending and extending just like this through, like I was when I was foam rolling, when I was scraping. I could even do squats to a box. I could do pistols to the box to really get in there. The more difficult the movement is, the more you can get at it. You can even add a little bit of jumping just to add a little bit of plyo to it to get a little bit of extra benefit. When you're using muscle floss bands, the closer the exercise is to the actual exercise that's painful or the movement that's painful, the more benefit you're going to get. But you're going to want to do it at about 25 to 50% of that force. So if I'm running with this or jumping with this, I'm not going to do all out 100% effort. I'm doing like 25% effort, jumping, bounding, just sort of allowing myself to get more contraction. After you have it on there for about a minute, you should have it on tight enough that you start to go numb in your toes. That's normal. You're going to want to take this off. The reason why you want it that tight is not just because it's going to break up the muscle tension more, but also because that allows for you to stop some blood flow, which will create an effect where when I take that band off, you're going to feel warmth because all of that fresh, good blood with the good mediators to help with healing are going to come crashing back in. You're going to create like a reperfusion of blood into the area. After you have gone and you have done some form of soft tissue work, you used either a foam roller, muscle floss band, you used the muscle scraper. What you need to do next is you need to add some length into that muscle, because most likely if you have patellar tendinitis or patellar tendinopathy, you have some tension in your quad muscle, which is contributing to that patellar tendon issue. So, I mean, my all-time favorite is just a good old-fashioned couch stretch, because you can really anchor down the quad itself and focus on bringing your chest up while you're getting a big stretch through here. Remember, what's important with this is, one, you hold it for long enough, so it's got to be about 30 seconds. The other thing is, if I get too close to here and it's too hard for me and I just arch in my low back and do this, I'm not stretching through the tendon. I need to push my butt back so that when my glute is getting near my heel, not just arch in my lumbar spine. That's how you get that quad stretch. The other thing is you need the knee to be bent. If I just do a simple lunge stretch and my knee's down and I'm squeezing my butt, I'm not stretching my quad. I see a lot of people just kind of like do one of these where you're just holding and bringing your heel towards your butt. There's so many issues with this. Mainly is like you're balancing and contracting while you're trying to stretch. The other is people come out and kind of get lazy, or they're up here. Your knee needs to be back while your heel is here. You need to not arch in your lumbar spine, so you need to tuck your pelvis while you're doing it. If you want to do this stretch, hold it here, tuck your pelvis underneath, and you'll feel all that tension build up. Any quad stretch will do. There's not just one, but the couch stretch is a way of eliminating a lot of variables so you don't have to be perfect and you still get a big quad stretch. So, after you've broken it up with the muscle scraping tools and whatnot, after you've broken up that thickness and you've stretched and added some length into it, Now what you want to do is you need to provide some strength to retrain the appropriate behavior of that muscle. We're going to do a level changing movement, or knee flexion extension, especially specifically knee extension, is going to be good. So, I mean, one of the things people can do is you could literally just do quadricep extension or knee extension. This could be on a machine with light weight. You could have a band attached to your ankle. You're going to do higher reps, lighter weight. It's not about high weight. It's about high reps and strength endurance built up in the quad and in the tendon. Some of my more favorite, more functional movements are, I love single leg pistols. So you're going to focus on the eccentric more than anything. If your tendon's really angry, you're actually only going to focus on the lowering down and then come up with two legs, because the eccentric is where you are getting the most amount of force in that patellar tendon. The concentric, or the standing, is less important when you're trying to rehab patellar tendinitis. Ultimately, it's really important because you need to be able to do that. But in the beginning, if you have to, you could just focus on lowering down and coming up with 2 feet. You would do maybe 10 on each side, 2 sets to 4 sets, working up as you can, depending on what phase you are at in the healing. So again, what's important about this is that I lower down under control. I allow my knee to go over my toes. While I'm on that, how do you know if you should elevate your heels or not? There's a reason why you would elevate your heels or not elevate your heels. So when I elevate my heel, right, and say I have my heel raised and now I'm doing a pistol, one of the bigger differences is I'm getting a lot more quadricep. I could feel that burn in the quad muscle pretty much right away. That you can do for this, but why would you not do it this way and you would instead do it this way? The answer is, if the reason you're getting patellar tendinitis is because your mechanics of like knee bend are just off, whether you're squatting or jumping, you already are just so quad dominant and just throwing your knees forward, but not hinging rather backwards in your glutes, you should not be elevating your heels. You would elevate your heels just to focus on getting more work out of your quadriceps muscle and your patellar tendon. You'd put your heels down if you wanted to focus on your squat mechanics. If your knee hurts because your squat mechanics are poor and you keep elevating your heels, you're going to cause more problems. So on that note, any kind of exercise where you're retraining your glute and your hamstring, your low back, to respond more appropriately when you're hinging, you're getting more posterior chain involvement, so that way you're not all anterior chain dependent. Those are good exercises too for patellar tendinitis, even though they're not necessarily directly going at the patellar tendon. Doing lunges, doing single leg RDLs are a big favorite of mine. So you definitely need one exercise where you're doing some kind of level changing. It could be goblet squats, it could be lunges, it could be step ups. It should be lightweight, and it should really be focusing on that bending and straightening of the knee. You should also have an exercise that's working on recruiting your hamstring, your glute, and your low back. So single leg RDLs, double leg RDLs, asymmetrical RDLs are really great. Those 3 are my favorite to pick from. Should be lightweight, should be high rep. You would want to do the strength exercises, those accessory exercises, at least once a week. Depending on where you're at, you could do them up to 2 to 3 times a week, but if you're going to do multiple days, what I recommend is choose a different quad stretch each day. Choose a different quad strengthening movement each of the days that you're performing quad strengthening movements. So you're not just always doing the same one. That'll allow for more variety. It'd be better if you were doing an accessory quad exercise 3 days a week instead of doing 3 exercises in just 1 day of the week. So it might be goblet squats and then single leg eccentric squats, and then maybe I throw in heel elevated squats, but choose a little bit of variety so that way you hit more. To recap, you're going to need to do a muscle scraping exercise at least once a week, or you could do it 3 to 4 days a week, but give some space between those days. You should have a day off. You're going to follow the muscle scraping exercise with a lengthening exercise. You're gonna always couple those, but you can do muscle lengthening every single day. The other and the third and final thing you're gonna do is some sort of strengthening movement where after you've broken up the thickness and you've increased the length, now you're going to retrain the tendon. You're gonna follow that with any kind of level changing movement, pistol to a box squat. You could do heels elevated or down, goblet squats, lunges. But if you wanna add some extra to it, you can do other areas and maybe spend more time. If you only have 10 minutes, focus on what you need to do. But if you want to spend 20 minutes or more in a single moment or effort, you can add a little bit more variety, all right? If you have any comments or questions, definitely share them with us. Be happy to clear up anything that you need or go into more areas. Appreciate how much you guys have been getting involved. Like, subscribe, share. It's making a big difference for us helping others, and your stories have been really great and helpful for us. I'm Doc John from Mobility Doc. Thank you for watching.